Hi, Meg.
Hey, Lizette, how are you?
I'm good. How are you?
Good. Happy Friday.
Happy Friday.
Thank you for joining me again. Love seeing
Yeah.
your face every week. This has been so
Oh,
fun.
I know it really has. Thanks for having me. I always enjoy your warm welcomes.
Of course. Well, to everyone watching at home, thank you for joining us. My name is Meg Storm. I'm the editorial director here at Edit, and we're in part 3 of our 4-part series. Every week this month, we've been going live to kind of discuss the best and kind of trendiest in-office procedures and comparing them to their at-home counterparts. So hopefully you can kind of kick off this new year with a great new skincare routine. And Lizette has been my partner in crime through all of it. So for those of you who aren't familiar with her work, she is a aesthetic nurse, injector, and kind of overall skincare expert based in Southern California. And she has a great Instagram feed full of beauty and wellness and skincare tips. It's at Lizette Ludwig _RN. So definitely give her a follow. And Lizette, I would love to kind of kick things off by having you introduce yourself to everyone.
So, hi everyone. I'm Lizette, and thank you, Meg, for the warm welcome. And I'm an aesthetic registered nurse. I've been in this aesthetics slash dermatology space for over 12 years. And just, through the time of just being in my field of specialty, I've really developed a love and kind of I would say it's my niche now where I love these like non-invasive type of treatments. And I've really been able to see the results,
Yeah.
from skin maintenance and from patients, just being consistent with the overall treatment. So yeah, I've had a love for all this stuff.
As do we, which is why
Yeah.
I feel like this has been like the perfect partnership.
Yeah.
If you've missed any of kind of our conversations the last couple of weeks, we've talked about microneedling and kind of comparing it to derma rolling. Last week we talked about kind of the difference between medical grade and at-home chemical peels and exfoliation. And this week I'm really excited because we have another topic that I think really applies to everyone and can be incorporated for a lot of skin types and skin tones.
Yes.
And that is LED light therapy. It kind of comes under a lot of different names. Some people call it low-level light therapy, phototherapy. LED itself stands for light emitting diode. So there's a lot of things you can call it, but kind of the fundamentals of it is similar. And it can really treat a variety of things. I'm excited to dive into them. Obviously, it can be done at home. It can be done in office. If you're going to kind of go the DIY route, we obviously always recommend that you consult with a skin expert like Lizette or your dermatologist beforehand, just to make sure that it's safe and effective for you. But these treatments really do have a lot of appeal, which is why we chose to talk about them.
Yeah, they do. And really I know we're going to start with the in-office, but the at-home benefits are amazing with this one. This is one that you can definitely do at home and you can benefit, and it's really safe. So that's why, we love the LED light for at-home treatments as well.
Yeah, for sure. I actually did it last night, so I'm excited to share
Oh,
with everyone what
good.
my experience was like.
Good.
But like Lizette said, we'll get started on the in-office side just because that's kind of where this all originated. And obviously, if you have questions as we go, please feel free to drop them in the comments or use the little Q&A button down below, and we'll do the best we can to answer them as we go. So Lizette, kind of to start, can you just overall kind of give us the background of, what is light therapy and what are the benefits of it?
So LED, there's different wavelengths, and LED is a treatment that we can use in office for, and you can combine this type of treatment with other treatments in office as well. But you can use it for acne, you can use it for anti-aging,
Yeah.
you can use it for skin inflammation, skin regeneration. There's a lot of benefits, and now there's so many more studies now that you can actually use it for body inflammation and just overall wellness, overall wellness. They now have these beds that you can lay in, and they really increase your mood, and they're becoming a lot more popular. They are very pricey, but I really do think they are worth it. And I've actually had the treatments myself, and I can actually notice an improvement in just my overall mood, and just I feel better. So here's the catch with these treatments, with all of them, whether it's face, body, or anything, is you do have to do multiple treatments, and you have to continue, the treatments. And when I say multiple, it can be like up to 10. So it's a lot. And sometimes people, and it's a treatment like every week. That's for face and body, so that can get a little bit, to go somewhere every week, like, for 10 weeks can be a lot. So now they're, you know, they're doing so much with these devices where you're able to do these treatments at home. So
Yep.
it is really nice, and it's really they're very safe in office and at home as well.
And what are some of the procedures or other treatments that you often kind of pair it with? Because I know it, as you said, makes a really great complement to a lot of things.
You know, you can pair them with a basic facial. You can
Okay.
do it with a chemical peel. You can pair it with post a more aggressive type of laser if you're really trying to target different. Because the one thing about the LED, it's never going to give you results of like a really stronger treatment, you know.
Right.
But overall, it does help just the results of these deeper treatments. But it also, if you're consistent with it, you will start to notice just overall skin quality improvement. So you can pair it with, yeah, like a deeper laser, or you can also pair it with a microneedling, like post
Okay.
microneedling as
Cool.
well. So you can really you can play with it because it's very safe and it's very, you know, it's effective and it's non-invasive.
I was
Uh,
doing a little bit of reading as we were kind of working on the article for this week and preparing for this. And it's
yeah.
in a lot of ways, it kind of came from NASA in terms of the technology itself of like, originally it was meant to like help grow plants. And then they realized it like
I
helped
know. I
heal
was looking
wounds.
into that too. I was like, wow, that's amazing. I didn't even know like the full history behind it, but you're right. They used it for a lot of different things and like growing and healing.
Yeah,
So it's pretty amazing how, you know, how science works and how they can really use something like that and kind of bring it into
totally.
the beauty and aesthetic world.
And I think another important point is we often talk about with light, we're talking about, ultraviolet light and the dangers it poses to the skin and how you're supposed to avoid it. But this version of light is actually safe and has the opposite effect. It can be really, really healing.
Exactly, exactly. I looked into that too because when I first started these treatments, and even with lasers in general, just getting, you know, my training and
Yep.
those type of lasers, I always wondered that too. I'm like, well, wait a minute with the UV lights, but it is a completely different light. It's safe for your skin. It's designed for your skin. So
Right.
yeah, they're great treatments, and I do highly recommend that if you're in having an in-office treatment, ask your provider about pairing
Yeah.
it with an LED treatment because it can really kind of give that treatment a boost, a little collagen boost, and you know, sometimes there is an additional cost, but I definitely think this is worth it.
It's one of those,
Yeah,
it just, to your point about kind of the wellness benefits, I know the few times I've had it done professionally, I don't know if it's like what it is, just being exposed to light in that in a safe way, but it
I know.
really like the mood improvements. And I even noticed that when I was doing it at home, it really is kind of amazing what that just does to your overall well-being in addition to the great
Exactly.
skin benefits.
Yes, it really makes a difference. I remember I went to the Goop. Um,
Yeah.
this was way back when we can have events, you
Yes.
know, and they had this room that was completely, you walk into it and it was completely covered with LED
Oh
lights
my gosh, that's
everywhere.
so crazy.
It was really cool. And you sit in there and you go with your clothes and everything because there's other people
Yeah.
in there with you. Um, and you go in there and you get a little section and, you know, you kind of just sit there for 10-15 minutes. And
Yep.
it really, like you said, it really does just overall, it improves your mood. You immediately feel like, because it's almost like skin plumping, you
Yeah.
immediately feel that warm sensation, like your skin. The results aren't immediate, the long-term results, but there will be some immediate feeling in your skin that you feel that it already feels like the circulation's better, you
For
know?
sure. Yeah,
Yeah.
no, it's one of those things. I don't know if it's all psychological, but regardless, like you feel
I
it and
know.
you see it on some level.
It's all mind over matter. If your mind is telling you that it's feeling good, your body feels good. That's all that
That's all
matters.
that matters. Yeah,
Yeah.
no. And so you mentioned it earlier, but one of the kind of interesting things about this are the different wavelengths involved, and those kind of
Yes.
appear as different colors, I guess is the easiest way to describe it kind of in layman's terms. So I feel like red and blue light are the most common kind of at the aesthetic end of the spectrum, right?
They are. The red is for anti-aging, and so you can kind of think of that one as, you know, fine line wrinkles and just overall sun damage and skin quality.
Yeah.
Blue we usually use for acne. The nice thing about the red and the blue is you can combine those, and they're often
Cool.
combined.
Okay.
So you can combine those two different wavelengths. And then there's green and yellow. Well, you don't hear about those as much, but they have been around for some time.
Yep.
They're just not as popular. And the green is usually the one that has to do with the more wellness, you
Yeah.
know, the wellness benefits, and also helps with like light sensitivity and migraines, I was
Interesting.
reading. So
Okay.
we don't use that as much in I would say in the aesthetic space, the green
Yeah.
light. But now that, you know, I think wellness is really kind of taking over, I do think we'll see more of the green light in the future for future treatments. And then the yellow light we use as well for just overall skin redness.
Okay.
And you can use it for broken capillaries. And there's a lot of lasers that are deeper than like LED lights, but
Yeah.
that we use to actually treat capillaries and
Gotcha.
broken vessels. This is more on the surface, but it can certainly help with overall diffused redness, which
Okay.
people, I think anyone who has redness knows that like it's something you're kind of always battling in some way. Even if you
Definitely.
address it with the laser, you kind of have to stay consistent with it because there's so many internal triggers with facial redness, you know.
If you have kind of rosacea or eczema or kind of some of those types of skin conditions, could this be therapeutic for them?
Absolutely.
Okay.
Yeah. And then that's when you would want to switch up that. You can still use the red light
Yeah.
therapy, but I would think they would benefit more from the yellow.
Gotcha. That makes
Yeah.
sense. And then in terms of really any skin tone can use this. And one of kind of the main, I feel like, person who wouldn't benefit from this or shouldn't use it is someone on Accutane, right? So it's a good acne treatment, but not for patients on Accutane.
And not for, because but Accutane is an acne medication. For those of you who don't know, that's a very strong derivative of vitamin A. So really makes you light sensitive, just in general, not just to the UVA. It's just your skin is very sensitive. So you just wouldn't want to run the risk. You'd be surprised. Maybe patients would be fine. Some patients know their skin and they might be fine. But just to keep it safe and play it safe, when you're on Accutane, you really have to do, you know, what your doctor's asking you to do, which is stay away from any light therapy and wear sunscreen and just keep your like skincare so basic and simple, you know, because your skin's already going through so much from the inside.
Yeah, no, that makes sense. And so you mentioned earlier, this is a commitment in terms of seeing kind of long-term results. And so you usually recommend, you said around like 8 to 10 treatments, right?
8 to 10 treatments we normally recommend at about a week apart.
Okay.
So you're kind of in the office a lot. So that's why these at-home, you know, therapies now for LED, I think, you know, I really think there is a space for it. And I really think that this is something that you can really do at home. And now there's devices like, I don't know if you've heard of Saluma.
Yep.
Saluma is a really good company who, and there's other ones too. There's Lightstim. There's, I think it's Juvie. Juvie's really good too. They're all great. Saluma's nice because it has like, it's a little bit more, how should I say? It's like pliable and kind of like you can put it on other parts of your body too. So that's nice. But you can do these treatments at home. So you can always, you know, if you're going in for your once a month treatment, do it there, but then do like the remainder, because sometimes it's not convenient to go somewhere once a week.
Absolutely.
So if you can do these that are just as powerful as in office because they are safe, they are effective. Now, if you're using like a device, like I have a new face and it has an attachment, like an LED attachment.
Yep. And
so
it's
if
more
you're
targeted.
doing something like this, you know, might not be as strong as effective as the ones that I'm suggesting, like the Saluma or the
and I have this guy, which is the Priori one.
The facial, oh, that's nice.
That is also flexible, kind of like you were saying, which is really great. So this is the one I mentioned in the beginning that I did last night. And to your point about effectiveness, when you look at the wavelengths on this one, it's dual wavelength, and you have kind of both the red and the near infrared, which I think very much mimics what you would get professionally. I feel like that, from that perspective, to your point, it really does kind of measure up to what you would be going in for 10 treatments to get.
I do. I really do think this is one of those that you can really get the same effect if you're using a quality, you know, type of LED light. You can really get the same as in office as you would at home.
Yeah.
But that might be something to think about, you know, to invest. This might be one of those at-home devices that you might want to consider investing in, because some of them are kind of pricey. The one I have is just an attachment, so it's not really that much. And in office, I've used Lightstim, I've used Saluma, but now you can purchase those at home.
Yeah.
So,
no, and this particular one, to your point, I think it's around $395. But again, you're kind of, it's that initial investment that could potentially save you those regular trips to your
Exactly.
provider's office to kind of get this done. And I used it last night because I think
Yeah.
the treatment protocol on this to see results similar to what you said, it's like use it 3 to 5 times a week for a month, and that's kind of your initial benefits period, and then kind of maintenance from there.
Yeah.
But I think what I was pleasantly surprised by was I really did wake up this morning and I was like, oh, wow, to your point about redness, like I'm prone to redness, like right around my nose.
Yeah.
And to me, it was like, it was diminished for sure.
Yeah. I
And
think
then,
if you follow it as the manufacturer is recommending, I really do think you will benefit from these treatments, these at-home treatments. And it's relaxing too.
it
You know,
is.
it kind of gives you that time to 20 minutes to just zone out a little
Yep.
bit.
No, this one, what I liked about this one was that it had a timer. So like when the 10 minutes were up, it just turned off. I didn't have to think about anything, but I
Oh,
was like, oh, I
good.
could lay here for a while.
I know. Like, turn it back
Yeah.
on.
It's like, can this be longer? Yeah, no, I think it's one of those things where, again, it's kind of like that add-on to your a skincare routine you already have.
Yeah.
That is just like an easy way to kind of get that boost. I even noticed I used a product for the first time earlier this week that is a
Mm-hmm.
great product, but I think it was a little too occlusive for my more oily skin type. And so I
Yeah.
had a couple like whiteheads on my forehead that even those, like the inflammation was like diminished when I was done with it, which was just,
Yeah.
again,
And that
kind of
was
a,
just one treatment, right?
exactly. It was
Yeah.
like a really quick fix of like, yes, my skin wasn't dramatically different, but like little
Yeah.
tiny things that you do notice an improvement on.
Exactly. So I definitely think it's worth looking into, investing into. And I like either like what you have, like either a mask type
Yep.
thing, or because I feel like these wands, the ones that I had, they're kind of complicated to use, honestly.
Yeah,
But you can. I mean, if you already have a device that you can attach something on it, then go
definitely
for
try
it.
it.
But if not, you know, try to get the full face ones, and you can use it on other parts of your body that you
Yeah,
might, like your lower back, if you're feeling, you know, if you feel like you're a little sore, things like that. So I definitely think this is worth it. Look into a high quality manufacturer that makes these LED lights, and it's definitely worth doing one of these treatments at home, and being consistent with them.
yeah, and a lot of the at-home ones have the ability to be FDA cleared, which the one I have is. I think the one you have is as well, and I think that's a
Yeah,
good indicator too of kind of they've had to kind of
absolutely.
the claims that they're making had to have been validated and proven, and so you kind of know that you have that safety and efficacy behind it.
Yes, absolutely. Always, yeah. I think when you're looking at these at home versus in office, it is important to look at, you know, the research behind it. And if it's something that, you know, requires that the FDA approve it, I definitely think it's better to go in that direction.
Definitely. And then if you, whether you're doing it at office or in home, is this the kind of thing, Lizette, that you would recommend like around a big event or like kind of a good treatment just to like
Oh,
get your skin looking its best?
for sure. Like if you can plan ahead, and, you know, because you will have to do those multiple treatments, but if you
Yep.
can get at least a good, like even 5, you know, before your event. And, you know, it's nice because they're once a week, or the ones at home are every day.
Yep.
So you don't have to plan too far ahead, you know, maybe just make some time like a couple weeks before and just be consistent with using it daily.
And
And yeah, absolutely.
if you're going into the office, is it around a 20-minute treatment? Is that what people can expect time
Yes,
wise?
it's about a 20-minute treatment. And 1 week, you know, you want to come in about every week or so. But yeah, it's about a 20-minute treatment.
And is there any kind of potential? I know there's really not a lot of downtime. It's obviously painless. Might someone experience like a little bit of redness, or is that kind of what people could expect
Yeah,
to see
I mean,
afterward?
that would be the only concern, you know,
Yeah.
but it's really nothing to worry about. Like it would usually subside within 5 or 10 minutes. If you're somebody who maybe has like an active rash or something like that, I would not maybe recommend doing it until it
Yeah.
clears up, or the Accutane like we discussed.
Right.
But you know, doctors even use this now for, you know, eczema or psoriasis. So you really can use it for so many different type of treatments, and they're really, you can use it's safe for all skin types. The only thing we look out for is skin sensitivity. So,
Yep.
and that would be something you can discuss with your provider. You may want to tell them I have really sensitive skin, so maybe we won't leave it on for 20 minutes. You know, we might check you halfway through and see what it's like.
Yeah, and actually with the mask that I had, though, it actually recommended a sensitivity test on your inner arm, which I thought was interesting.
Oh, cool.
Just to see if like if you did have redness or any of those things you kind of talked about. So I
Yeah.
did that first and it was fine. And so, and
Especially because if you do the at-home ones and then you do have some, you never know, right?
no,
And you can
exactly.
have some type of reaction. You never know.
Yeah,
And it's like, then you got to go to your derm's office and it's kind of like, pain to go through
exactly.
all
Then
this
it's like
stuff.
not
So
fun
yeah, I
anymore.
would definitely recommend if there's something like that, test your skin out because these treatments, they work and they make a change. So with that there's always a small risk.
Absolutely. No, that makes sense. And then is there, I mean, compared to some of the other kind of treatments that we've talked about, I feel like this one really feels like it's a great kind of add-on for really anyone for any reason and can really fit into whatever you're already doing. So if like you have a new face and are doing microcurrent, which is what we're going to be talking about in the future, like there,
Yeah.
it just really kind of pairs well with a lot of at-home things and all the in-office things you mentioned.
It really does. Yeah, that's why I was saying I really think this one's worth it investing into something that, whether it's 300, I mean, the Soluma can run up to 1,500, I think.
Yep.
So they can get pretty pricey. But I really do think it's worth it. I do think it's worth it. And I think there's other benefits, like if you can use it on other parts of your body for other type of just overall, swelling or inflammation, then I definitely think it's worth it. I personally have come to a point in my life now that anything that has to do with wellness that really kind of takes care of your body and your overall, it's not just about I really think it's about the way you feel. It's not just about the way you look, although our looks do help, but they help you feel better. When your skin looks nice, you feel better,
you feel
and
good
like that. Yeah, but I really do think that it's worth the investments because it's your health, it's your wellness, and it's your overall, it's just like the way you're caring for yourself.
Yeah.
So I do think some of these things really make a change in just the way your skin feels, and whether it's like we were saying, like whether it's like pain in your body or things like that. But I definitely think it's worth the investment. And I think this one might be worth the investment doing it at home. So you don't have to necessarily go into your doctor's office every week to do it.
Which I feel like, especially in these times right now, like the more things you can do at home, the easier and the better it is.
I know. Hopefully that does change at some point, but yeah.
For right now, yeah.
For now.
And I feel like we obviously, you mentioned other parts of the body. Also, I feel like the neck and chest is a really obvious area too, right? That can kind of have the same, anti-aging benefits, I guess, that you would want on the face.
Exactly. And the face and the face and neck and the chest, I think, like you're saying, like the same benefits. With the body, it's harder to get those anti-aging benefits, but you'll get more from it in other ways. Like we were talking about just overall inflammation, because I think we all somewhat have that in some way or another.
Yep. And I was even thinking your kind of more targeted device on the back of your hands would probably be a nice, like effective treatment there.
There's just so many, I really think there's so many benefits to having one of these devices at your home. You know?
Totally. No, well, we're both fans, obviously. And if you want to learn more about kind of the benefits and then what the different wavelengths and colors mean and how they can benefit you, we do have a great article up on edit.com today with Lizette talking all about this and diving into the history a little bit more. So definitely check that out. And if you missed any part of this video, it's going to be on our Saved to our IG Live, so please, our IGTV. So please definitely watch it back. And then we're excited because we're going to be finishing up this series soon with kind of a deep dive into microcurrent, which I think is another great treatment that you can very much do at home.
Treatment.
Yeah. So I'm excited to talk to you about that in a couple of weeks. And we thank everyone so much for joining us.
Thanks for joining us, everyone. Thanks, Meg.
Thanks, Lizette.
Have a great
so good
weekend.
to see you. You too.
Bye-bye.
Bye.